about weight regain. Last week we discussed the endo-sleeve procedure, which, as you know, is a minimally invasive, very safe, very effective new technique for losing weight. Today we're going to switch gear a little bit and talk about weight regain. Now, the question, the topic of weight regain is a very common phenomenon. It is, in fact, common to all kinds of weight loss techniques, ranging from dieting, exercising, to bariatric surgery. So I want to lay some ground rules and tell you that it is a natural phenomenon. Every time we lose weight, our body tends to want to regain some of the weight back. Now, let's talk about why. Why do we regain weight? The common explanation for weight regain, or the state of being overweight, is something called a metabolic set point. Essentially what that means is when we gain a lot of weight, say for example we gain 50 pounds and we stay there for a month or a year or several years, our body adapts to this weight. It adapts in many different ways. So we build muscles to carry the excess weight. We actually eat to sustain this weight. We also develop hormonal chemical changes in our body to support this current weight. So that when we start to lose weight, either by diet, exercising, we skip a few meals, we skip the junk foods, we drink water rather than juice, we start to get to a point where the weight starts going off. Maybe we take some medication to help us with controlling our appetite. The weight slowly starts to get off, and then we hit a phase when we call the plateau, and all of a sudden we're doing everything right, as our friends, our family members, our doctors recommended, and the weight just stops going off. Even worse, we get to a point where the weight starts to creep back up again. The reason behind this, we think, is because our body is fighting to get back to this original metabolic set point of being 40 pounds overweight. Our body is fighting, is doing everything possible to get back up to that weight. It wants to conserve energy. It wants to save the calories as fat. It does everything possible to make this happen. Now, how do we break this cycle? That's what we're going to talk about today. We've established the fact that weight regain is common regardless of the technique that we're using to lose weight. It could be diet, exercise, or bariatric surgery. In fact, procedures such as a gastric bypass, we're talking about 40–50% chance of regaining the weight back after 10 years. Which means if you've had bariatric surgery and you've done successfully, you've done it very well, you've lost weight, you've achieved your goal weight, and then you realize that you're doing everything right, you're eating exactly the same amount of food, but somehow you're regaining weight, stop beating yourself up. Most of the time, it's not your fault, it's really your body fighting to get you back up to a higher weight. Now, of course, if you're doing the wrong thing, you're eating the wrong food, or you're not exercising, you're stressed out, and so on and so forth, this is a conversation we need to have. We need to have a conversation about getting you back on track. So, what are the steps that we can take to prevent weight regain or to control it? Number one is consistency. Weight loss is not a short run. It's not a sprint. It's not a short-term goal. It's actually a long-term goal. On average, it takes about 3 to 5 years to lose weight effectively and to keep it off. I repeat, on average, it takes 3 to 5 years to lose weight and keep it off. For some people who have been overweight or obese for even longer, this basically period of time can be as long as 10 years. The longer we've been overweight, the longer we've been obese, the longer the chance, the longer it's going to take us to lose weight and keep it off. So consistency, don't give up, keep on going for it, keep on trying, keep on dieting, keep on exercising, keep on drinking water. Secondly is water. Liquid calories is one of the biggest culprits for us to gain weight. We're talking about things like juices containing a lot of sugar. We're talking about sodas and carbonated drinks. You need to make sure that you're drinking water or any other zero-calorie drinks. Things like tea is okay, green tea is fine. Second is the fact that do not be fooled by those so-called zero-calorie drinks and zero-calorie sodas and so on and so forth. I'm not going to mention any brand name, but I want you to be assured that so-called zero is not zero. Some of those sweeteners actually can mess up our metabolism and make us gain weight. There's more and more science behind the fact that those so-called zero drinks are very harmful for our body. Thirdly, stress and sleep management. I cannot emphasize enough how it's important for you to sleep adequately, pay attention to your sleeping habits and hygienes, and manage stress efficiently. If you're having difficulties with managing stress, family stress, spouse, work-related relationship, there's so many techniques to help you with this, and we can talk in details about this. There's meditation, there's stress management, and so on and so forth. How can you adapt to situations that you can't control? Number 4, processed food and junk food. It's absolutely important to understand that these highly processed foods, the cookies, the crackers, the cakes, the junk food that we get, easily drive down the street, we can get 1,000 calories in 1 minute through a drive-through window. Those food have special chemicals in them that actually makes our body want to eat more and hold on to calories. Once again, you cannot lose weight and keep it off if you keep on going back to junk food. Thirdly, fiber intake. Make sure you're consuming at least 35 grams of fiber. Natural fiber, flaxseed, metamucil, whatever flavor you like, make sure you're keeping that on track. Now, specifically, I have a list of questions that were posed by my colleagues and friends and patients and family members about weight regain. So I'm going to start with the very first one. The first one is, what is the most common or number one reason for weight regain? Well, we just talked about that. It is high calorie intake, processed carbohydrates, junk food, lack of exercise, inadequate sleep, stress management, hormonal changes in our body, and we'll talk about how we can manage that with fasting. Intermittent fasting is another topic we're going to talk about in the future. Those are the reasons. It's a natural process. It's not your fault. Your body really wants to go back to a heavy weight if you've been heavy before, and it's going to do everything to sustain that weight. So you need to learn how to manage that. What advice, question number 2, what advice would you give to your surgical patient to avoid weight regain? Well, to my surgical patients and to any surgical patient, anyone who's had a weight loss operation, a metabolic operation in the past, it is very important to go back to the first answer. You need to count your calories. You need to weigh yourself on a regular basis. Don't wait for the weight to creep back up. You really want to start ringing the alarm bells if you find out you're gaining weight, or weight that's been stable before is suddenly creeping up. Very important to go back to basic principles. Drink water, avoid liquid calories, avoid the zero drinks, avoid processed carbs, avoid junk food, exercise adequately, drink enough water and fiber, and also fast intermittently. Number 3, which surgery from your point of view that you will say has the highest rate of weight regain? This is a very difficult question. We can talk about how effective a bariatric operation is. And we can start with something like the gastric balloon, for example, or the lap band, or the gastric sleeve, the gastric bypass, and the switch, the duodenal switch. The duodenal switch is one of the most efficient weight loss operation that we can offer. The weight regain, consequently, is lowest. The more effective a procedure is, the less likely the weight is going to come back. So, consequently, weight regain is common with, for example, if you diet and exercise or use medication, weight regain with that can be as high as 90% over 10 years. With the lap band is less, with the endo sleeve is a lot less, with the gastric sleeve even lower, gastric bypass even lower, the switch lowest. Number 4, is there a correlation between the initial BMI or weight and weight regain? We don't know the answer to this. I personally do not know, but I'm going to research this question and come up with an answer during one of our next episodes. So far from my reading, we do not have an established relationship between weight regain and initial BMI. Number 5, how does stress and environment play a role on weight regain? Now, this is a very good question. If you go back to the original talk at the beginning of this talk about weight, stress management and environmental control as a way of reducing our chance of gaining weight, I want to assure you that stress is a much stronger factor to gaining weight than actually exercise. This has been established. If we're stressed, there's a hormone in our body called cortisol, which rises up and actually makes us store fat and gain weight. The amount of stress and the duration of the stress is directly related to the amount of cortisol that we produce, and therefore more stress means more weight gain. It's very important to establish skills. It can be coping mechanisms, talking, adaptive mechanism, meditation, to allow you to not only understand what your stress is and how to cope with it. I emphasize, stress is a very strong factor for gaining weight. Number 6, recommendations to avoid weight regain. If you remember what I just said at the beginning of the talk, I listed out the 6 to 7 factors, the steps that we can take to avoid weight regain, and I'm happy to write this up in a blog and print it out online so you guys can have access to it. Number 7, this is one of my favorite questions. How do I figure out how many calories I should be eating? Well, this question can be rephrased as, how exactly should I be eating? When should I be eating? And it depends on whether you want to gain weight, you want to lose weight, or you want to maintain your weight. So, one of the easiest tools that I found is called MyFitnessPal. And I'm not being sponsored by this company, but I'm just telling you that this is one of the most effective tools to help you with controlling, being responsible and taking ownership of what you eat and what you consume, and measuring your calories is actually one of the most effective ways of controlling your intake. So MyFitnessPal is an app that is available. It's free on iOS, Android, or any platform that allows you. It's essentially a huge database of food from different sources, restaurants, supermarkets, and so on and so forth, that by typing a few keywords you can find out what you add, and you can calculate the calorie, but not only the calorie content, but also the salt content, the cholesterol content, and so forth. Now, some people will say that MyFitnessPal or any calorie counter is difficult to maintain. I tell you, that is not true. I am a surgeon in a very busy practice. I'm a father of 3 children, and I'm a husband, and I have extra activities. I run a lot, and I bike a lot, and I have so many things going on, yet I'm able to log my food. I've been able to do it now consistently for 12 months. It is doable, and it works. MyFitnessPal allows you to establish a goal. Say, for example, I want to lose 20 pounds. You plug that into the app, it's going to now tell you how many calories you need to be consuming on a daily basis in order to achieve that goal in, say, 6 months. So that's how you find out how many calories you need to be consuming. However, I want to caution you, there are established amount of calories that is minimum to allow us not to go into starvation. Our goal is not to go into starvation. Our goal is to go into a weight loss or weight maintenance regimen. So we definitely don't want to starve ourselves. For women, we're talking about a range of 800 to 1200 calories a day. For men, about 1200 to 1500 calories a day to avoid starvation. On top of that, if you exercise, you get credit. For example, if you run 5K at an average pace of 9 miles per minute, 9 minutes per mile, you gain 350 calories, which means now you can have room to consume more calories to still, lose weight. So MyFitnessPal, I recommend strongly. If you don't like MyFitnessPal, there are other calorie counters out there that can help you. If you remember, the range is 800 calories to 1200 calories for females to lose weight and avoid starvation. For male, it's 1200 to 1500. And the last question, is it true that eating after 8 p.m. makes you put on pounds? Yes, yes, yes. More and more data is coming out about what is it? Is it how much we eat? Is it how often we eat? Or is it when we eat? And we're answering the question thusly. Number one, what you eat obviously has an impact on how much you weigh and your weight gain. When you eat also plays a significant role on weight gain. How often you eat also plays a big role. Now, we talked a lot about how much we calculate, we estimate our calorie intake, and we try our best to sort of like, move the dial around a little bit, reduce our calories in order for us to lose weight. When we eat is important. It is now recommended that we should not eat any meals after 6 p.m. In fact, a new study came out last year that shows that 4 p.m. probably is the best time to have a last meal. Now, I'm not saying you can have any water in the evening, or you can have a little bit of snacks like almonds or something like that. That's okay. But a meal, which is sit down, have a meal, should not be later than 6 p.m. Maybe this year we might come out with 4 p.m. But right now I'm thinking between 4 p.m. and 5 p.m. will be the latest time you should be having the meal of the day. Now, how often we eat, that goes into a new topic, which is basically fasting. And I'm very excited about this topic. It's something that I'm really very, I've seen works a lot, both personally as well as for my patients and family members. So, and that will be the topic of next week show. It will be about intermittent fasting and weight loss. I thank you for joining me, and if there's any questions from our live audience from Facebook, YouTube, or Twitter, or even Instagram, kindly go ahead and either direct message me or email me your questions. I would love to answer them today or during a future episode. Thank you, and have an incredible week.